Hello my dear friends, welcome back to my channel with a new video and again in two parts, and here we are talking about evidence-based medicine. So this was a talk which I presented during a pro-con debate, one of the pro-con debate on a webinar, and I talked on the pro aspect of evidence-based medicine. So let's start. So at the outset, I feel that evidence-based medicine is a pure and indisputable science, and I have no doubts in my mind as regards uh, the pro aspect of the same. Now, when you talk of EBM, that is evidence-based medicine, it is based on a triad, and that is individual clinical expertise, best external evidence, and patient values and expectations. And when you can see the overlap of all the three circles is EBM. And David Sackett, which was a famous uh, personality and a gentleman who put forward this concept of EBM, which talked about conscientious, explicit, judicious, and reasonable use of modern and best evidence decision about the care of an individual patient. So, what what is EBM? It is actually a lifelong process. It is self-directed. It helps us to have a problem-based learning, and also takes into account clinically important information like diagnosis, prognosis, treatment, cost effectiveness, and better healthcare. And it demands the better evidences with systemic reviews and meta-analysis. So, if you look at the history, it was originated way back in the later half of the 19th century, and there are references of ancient Greece and China. And it was first used by David Eddy way back in 1990. So, here we are talking about at least about 35 years back, and it was first time in medical literature in 1992 by Guyat in a most pragmatic fashion. So, if you look at the types of researches, and this is a kind of a pyramid which you can see, where the base is the least or a weak research or evidence, and the apex has the most of the strongest evidences. So, if you start with in vitro test tube research, then you have so it is in the laboratory, then you have an animal research, then of course the ideas in the editorials or the opinions, followed by the case reports, then you have case series, case control studies, cohort studies, the randomized control studies, and of course the randomized control trials where there is double blinding. So these are the types of researches which we should know of, and these are the 5 A's in the steps in practicing the EBM, where one need to ask the questions to himself or herself, is basically to ask about the structure of clinical question, acquire the evidence, appraise the evidence, then you apply the evidence, and of course analyze and adjust the outcomes. So this increases the likelihood of favorable outcomes when we ask 5 A's as far as practicing the EBM is concerned. So step 1 is asking the answerable question, and this is a PICO model, which stands for patient, intervention, comparators, and outcome. It helps in structuring the literature search to a much better answer which can be located. So for an example, what is the best treatment of heart failure? Not following PICO. Whereas in elderly patients with systolic heart failure, do ACE inhibitors reduce the mortality in comparison to placebo? This is the following. This is following the PICO model. So this question is more relevant than this question, which is just asking what is the best treatment for heart failure. So, what is expected from us? You know, for an example, a general practitioner which reads about 19 articles per day, or target reading to issues related to specific patient problems, not a cookbook medicine. And clinicians who fear top down cookbooks will find the advocates of evidence based medicine joining them at the barricades. And today, in almost all the Western countries, doctors apply EBM, and they have support from the government, the Ministry of Health, and of course the pharmaceutical industries. So, Silverman WA, where is the evidence, which was in the Oxford University Press in 1998. This was the reference for the same. And another important thing is do no harm, and of course have the assessment of risk benefit ratio. And by far the best reference point which every clinician, forget about an intensivist, which takes into account is the Cochrane Library. With this is the website www.cochrane.org. So, how EBM is beneficial? So, there are definite advantages where the questions, there are no intuitive answers. The clinical observations which cause more harm than good, like say thalidomide during the pregnancy, use of the best possible evidence for the best possible solution for optimum health care. It avoids major mistakes, it maintains the quality, it saves the time, and in turn saves the patient lives. It raises the own benchmark and increases the satisfaction level. It saves the doctor's time and builds the confidence. So if you know what to search, where to search, of course all these points which we discussed will be dealt with. So there are obvious advantages is EBM attempts to find and incorporate interventions that work, not those that should or seem to work. Understanding EBM concepts helps improve the ability to keep up with new information and developments. And of course, EBM practices, it allows the practitioner to use critical thinking skills like assess, analyze, and apply the evidence at the correct point in time or situation. So, as far as the achievements of EBM till now is concerned, it definitely has prominent presence in scientific forums and literature. As I said, Cochrane Library, the Cochrane collaboration, over 400 systematic reviews of clinical trials exists with the Cochrane Library. They help us to formulate the guidelines, and of course in the form of advocacy, for an example oseltamivir or zanamivir. It can reform the medical ethics and professionalism, and of course maintain the standards and essential component of the medical practices. So the top 15 milestones in the last 160 years which have been achieved is only because of evidence-based medicine. So this is the reference which I took from BMJ 2007. So these are few of the achievements of EBM, and I think I will stop here. And this was just the part 1 of EBM, and I'll come back to you in my part 2 of EBM. So that's all for now. Bye bye. Take care.